Morning, everybody. My name is Scott Christensen. I'm a nurse practitioner with Urology San Antonio. I've been here for 10 years. I treat men's health and I absolutely love what I do. Testosterone therapy is all the talk about feeling young again. As we continually to search for the fountain of youth, let's break a few things down about testosterone therapy. First of all, what is testosterone? Testosterone is a hormone produced primarily in the testicles and helps maintain men's bone density, fat distribution, muscle strength and mass, facial and body hair, red blood cell production, sex drive, and sperm production. So what happens to testosterone levels with age? Well, testosterone levels generally peak during adolescence and early adulthood. As men age, our testosterone levels gradually decline, so typically about 1% a year. For older men, it's important to determine if low testosterone levels due to normal aging or if it's due to a disease process known as hypogonadism. So hypogonadism hampers the ability to produce normal amounts of testosterone due to a problem with the testicles or with the pituitary gland that controls the testicles. So testosterone replacement therapy in the form of injections, pellets, patches, or gels can improve the signs and symptoms of low testosterone in these men. So another common question I get asked is, does a naturally declining testosterone level cause the signs and symptoms of aging? Well, not necessarily. Men can have many signs and symptoms as they age. Some that might occur as a result of lower testosterone levels can include changes in sexual function. This might include a reduced sexual desire, fewer spontaneous erections, such as during sleep, and infertility. It can also cause some physical changes. Various physical changes are possible, including increased body fat, reduced muscle bulk and strength, and decreased bone density. You might also have less energy than you're used to. Another common change you might experience is emotional changes. Low testosterone can contribute to a decrease in motivation or self-confidence. You might feel sad, depressed, or have trouble concentrating or remembering things. In fact, I very commonly see it. Depression in men is actually very commonly misdiagnosed when it's actually low testosterone. So some of these signs and symptoms can be caused by other factors, such as medication side effects, obstructive sleep apnea, thyroid problems, diabetes, and depression. It's also possible that these conditions can actually cause low testosterone levels, so treatment of these factors might result in increase of testosterone levels. Question: can testosterone therapy promote youth and vitality? So testosterone therapy can help reverse the effects of hypogonadism, but it's unclear whether testosterone therapy would actually benefit older men who are otherwise healthy. If men are asymptomatic or not having any symptoms of low T, I really do try to keep them off of testosterone medication. So what are the risks of testosterone therapy for normal aging? I get asked this all the time. Testosterone therapy has various risks, including causing an elevation in the PSA. The PSA is actually a screening tool that we use to check for prostate cancer. Now, testosterone therapy does not cause prostate cancer. It's actually helping me diagnose prostate cancer in individuals that otherwise would have gone undiagnosed. So testosterone also stimulates red blood cell production, which contributes to the increase of risk of forming a blood clot. A clot could break loose, travel through your bloodstream, and lodge into your lungs, blocking blood flow, which is known as a pulmonary embolism. So anytime we start testosterone therapy, we monitor blood work very, very closely. Testosterone can also decrease sperm count, leading to infertility. This concurrently can cause testicular shrinkage and/or atrophy. So testosterone has also been known to worsen sleep apnea. Sleep apnea is a potentially serious sleep disorder in which breathing repeatedly stops and starts. Also, in some instances, testosterone can also cause acne or other skin reactions. So question: when should you talk to your doctor or provider about testosterone therapy? If you wonder whether testosterone therapy might be right for you, talk with your doctor or advanced practice provider about the risks and benefits. Our Urology San Antonio providers will likely measure your T levels at least twice before recommending T therapy. Treating normal aging with testosterone therapy is not advisable, and if you don't have a medical condition that's contributing to your decline in your testosterone levels, we might suggest natural ways to boost testosterone, such as losing weight and increasing muscle mass through resistance exercise. As always, we here at Urology San Antonio are here for your medical needs and support, and we look forward to helping you. Thank you.